Hi everyone, welcome back to Living a Balanced Life with Julio. On today's episode, we're going to talk about fasting. How you stay safe while you're fasting when you have type 1, type 2, or pre-diabetes. During Ramadan, during Lent, during other religious fasting, how can you stay safe and still be able to participate in your religious belief? If you're interested, please stay with me. Many religions promote some form of fasting as a spiritual discipline, and medical literature indicate that fasting can actually be good for you. It can help stimulate weight loss, it can decrease inflammation from chronic conditions like arthritis, it can improve blood pressure, and it can reduce cholesterol. So fasting is not bad for you. It's good, but it has to be planned ahead of time. So there's tips to help you make sure that you are participating in your religious belief to help keep your mental health up to par. Include planning ahead of time, monitoring your blood sugars, keeping hydrated, being mindful of sugary foods, being aware of overeating, and of course, last but not least, exercising and sleep. So number one is planning ahead of time. Most people that participate in religious fasting knows when they're going to be fasting. For example, a Muslim will know that fasting month starts in May and ends sometime in June. So it's important, if you have type 2 or type 1 or prediabetes, to plan ahead, speak to your healthcare provider, speak to your doctor, speak to your diabetic educator, and come up with a plan that can help you organize your medication, know when to test your blood sugar. So these are things that keeps you safe, so you don't get yourself in trouble while you're fasting. Most of the time, most people that get in trouble or get some kind of negative reaction when they're fasting is because they're not planning ahead of time. So if you plan ahead of time with your doctor, because certain medication you have to take with food, then you can know when they will advise you when to take those, and based on when you're eating. If you're someone like on insulin and you're taking your insulin before meal, so your doctor will speak to you, they will adjust the dose so you know exactly how much to take to stay safe, so you prevent yourself from getting into diabetic emergencies like hyperglycemia, which is extremely high sugar, or hypoglycemia, which is extremely low sugar. You need to really take everything into consideration when you plan to fast, including when you're going to eat. Meal prepping in advance is a very useful way to make sure that you are eating quality food and you're not eating high sugary food. For example, pre-cooked meal rich in protein can help you nourish your body better than if you're not planning and you're just breaking your fast with any high fast carb sugary food. So it's important to plan ahead of time, not only for in terms of your medication and your blood sugar checking. It's also important to prep the meal so you have access to quality meals. Of course, it's important to also make sure that you have enough diabetes supplies, because while you are fasting, you need to keep a close eye on your blood sugar. And that brings me to my next point. Number 2, monitoring your blood sugar. So as someone with diabetes, it's very important to know what your blood sugars are, because this helps you plan in terms of taking your medication, in terms of your exercise, and then also in terms of speaking to your healthcare provider as to next steps on what to do. So if you're someone that monitors your blood sugar, let's say you have type 2 diabetes and you monitor your blood sugar twice a day or once a day during Ramadan or during the time of fasting, it's important to keep a close eye on your sugar. So have enough diabetes supply strips that you can monitor your sugar more frequently. So for example, if you're not feeling well, you have access to monitor your blood sugar and know if it's the sugar that's causing you to feel the way you feel. This will help you eliminate a lot of emergency visits, and it will help you be able to participate in your fasting, which is important to you for your religious reason. So when you break your fast, you're going to eat. So it's important for those people that are taking medication like insulin to monitor their blood sugar before they break their fast and before they eat food, because insulin that you're taking is based on what your blood sugar is at the time and the amount of food that you're going to be consuming. So it's important to keep a close eye on your blood sugar when you have diabetes. Before meal, the target for blood sugar is 4 to 7 millimoles per liter 2 hours after meal. So if you're going to check your blood sugar and you want to see how the food affected your sugar, you have to wait 2 hours, and after 2 hours you check your sugar. Anywhere between 5 to 10 millimoles per liter is the recommended target, unless otherwise specified by your healthcare provider, because some people, because of their other health problems or comorbidities, target may be adjusted that way. So someone with heart disease and someone with previous heart attack, usually your target is a little bit higher because the low sugar can send your heart into arrhythmias. So it's important to know what your target is and know how to work within that target. Right, so it's important to do your before and after meal and to stay safe. For example, because you're fasting, there's a chance that your sugar may go low. And when your sugar go low, it's called hypoglycemia. And hypoglycemia is when your sugar is less than 4. So knowing this is important, and knowing how to treat hypoglycemia is very important, and it will help you be able to participate in your fasting and stay safe. So if ever you're fasting and you start to feel dizzy, you feel short of breath, you feel like you're going to pass out, like lightheadedness, you feel shaky, you're sweating, not because it's hot, just sweating for no apparent reason, you feel your eyes, you can't really see properly, this blurred vision. These are all signs that your blood sugar is maybe low or going low. So it's important to be aware of these symptoms, because when you do have these symptoms, the best thing to do is to check your blood sugar. And if you check your blood sugar and it confirms that it's less than 4, then it's a true hypoglycemia, and what you do is you treat it with fast-acting sugar. This is the only time we want you to use fast-acting sugar, because it's going to bring your blood sugar up within 15 minutes into a safe target. So if you check and it's less than 4, then you treat it with either a tablespoon of honey, a tablespoon of sugar in water, and you drink that, or glucose tablets. You can take 3 to 4 glucose tablets, or if you don't have that and you have juice, half a cup of juice or half a cup of regular, not diet, because remember, diet is sweetened with aspartame, so that will not make your blood sugar go up. So after you do that, you wait 15 minutes and then you check your blood sugar again. If it goes above 4, then the treatment worked, and then you keep a close eye on your blood sugar. If you're fasting, this will be a good time to break your fast, because if your sugar is going low, it's going to continue to go low if it's not treated, right? So it's important to know ahead of time what you're doing and have a plan that, you know what, I have diabetes, I still want to participate in my religion because it's important to me, but at the same time I want to be safe. So you have all these in place. So the time you break your fast is when you are in a diabetic emergency where your sugar is dropping. Then you can break your fast. And sometimes, because medication are withheld, most people are able to participate in fasting without going low. But just have that at the back of your mind, that could happen, and have plan in place to treat it when it happens. Number 3 on the list include making sure that you're keeping yourself hydrated. Hydration can then result in a higher blood viscosity, because when you have diabetes and your sugar increases, it makes your blood thicker. So it's important to keep yourself hydrated to prevent the increased chance of thrombosis, which is blood clot, when you are dehydrated from diabetes. For diabetes who choose to fast during Ramadan and other religious fasting, it's important to drink plenty of water during non-fasting hours to stay hydrated, to prevent yourself from getting blood clots, which can lead to heart attacks and strokes and so forth. So it's important to make sure that you're drinking your recommended amount of 8 glasses of water during non-fast periods. Fasting among people with diabetes, someone with type 1, type 2 diabetes, who have inadequately managed blood glucose level, is associated with multiple risks. So it's important for you to be aware of what your risks are. And if you are someone that have diabetes and your sugar is out of control, it's not recommended for you to fast. But if you want to fast for religious reason, then you need to plan ahead. Like I said earlier, speak to your healthcare providers. Medication can be adjusted so you can participate in fasting. But while you're doing that, you need to keep a close eye on your body, keep a close eye on your symptoms, how you're feeling, because when you are participating in fasting and your blood sugar is uncontrolled, it can lead to potential diabetes-related complications during fasting that could be dangerously, like I spoke earlier about hypoglycemia, which is low blood sugar, or excessively high blood sugar, which is hyperglycemia. And for someone with type 1 diabetes, it can lead to diabetic ketoacidosis, and also thrombosis, which is blood clot. And diabetic ketoacidosis is an emergency that needs to be treated at the hospital, and it's important for you to have all these things in plan. So when something like this happens to you, if you have a family that you're living with, then you know what to do. Patients with type 1 diabetes who choose to fast during Ramadan are at a higher risk of developing diabetic ketoacidosis, especially if they had been experiencing hyperglycemia frequently before Ramadan. Diabetic ketoacidosis is when your body cells don't get enough glucose or sugar, and your body starts to burn the fat for energy. When the body burns fat instead of glucose, which is sugar, it causes waste products called ketones. Ketones can make the blood acidic, and this can be very dangerous for a person with diabetes. This usually happens people that have type 1 diabetes. The risk for ketoacidosis may be further increased due to the excessive reduction of insulin based on the assumption that food intake is reduced during the month of Ramadan. Number 4 is being mindful of high sugary food. So because you're fasting and you're not eating as often, it's important to choose high quality food when you eat. Avoiding sugary food will help you stay healthier, and it will help you to prevent overeating along the line. A healthy and balanced diet during Ramadan or during the month of fasting is recommended for everyone, but especially for those who have diabetes or pre-diabetes. Following a healthy plate is a good way, making sure that when you're eating, half your plate is vegetables, you have your grains and starches. You're choosing high quality grains and starches, high fiber and low glycemic grains and starches is a good way to make sure that you're getting quality food. Making sure that you are including protein with all your meals, because protein or high protein foods help you stay full longer and help your body slow down how it's turning the carbohydrate food into sugar. So as high protein meals is a good way for you to stay full longer, so then you can last throughout the fasting. So it's important to include protein. You can get protein through meat, an alternative. You can get it through nuts, seeds, lentils, legumes. All of those have protein. And then, of course, you can choose beans. They all have protein as well. So including some of these foods into your diet while you're eating, when you break a fast, is very important. But of course, you want to ease your way into it. So right when you break your fast, you want to have a smaller meal, and then later on have a bigger meal if you choose to. But don't have a big meal right away, because of course it can cause stomach upset, and it can cause weight gain, because when you fast, your body is thinking that you are in starvation. So everything that you put in your body keeps it a little bit longer. You want to slowly ease into your meal and make sure that you're eating high quality foods that can nourish your body, prevent malnourishment. Number 5, being aware of overeating. As long as you're underweight, it's important for you to not make up calories. Try to stick to your normal meal as much as possible. So don't make your meal extremely large because you're fasting. Because normally when you fast, you feel so hungry that when it's time for you to break your fast, you can easily overeat. Make sure that you're filling your plate with high quality food, like I said, making sure that you're getting all the different food groups, and you're getting a complex carbohydrate that is harder for your body to digest, and including protein. So this way, your body is even harder for your body to digest, meaning you stay full longer, your body from crashing from energy. Because if you consume high sugary foods or not quality food, then the chance of your sugar dropping is high, because it's very easy for your body to digest foods that are not complex, right? So it's important for you to make sure that you're nourishing your body and you're not overeating. So you stick with the same amount of normal food size that you normally eat. And if you do this can even help you maintain your weight, or for some people can help them lose some weight during the month of fasting. It's important for you to eat smaller meals, which will help you prevent overeating, which will then prevent elevation of blood sugar. So you will not spike in your blood sugar too high. So just stick as much as you can to your normal meal size, and to prevent yourself from overeating, because if you overeat, that can lead to weight gain. And then of course, if you're eating a larger meal towards the evening, it can lead to heartburn, indigestion, which can therefore affect your sleep. And that brings me to my next point, which is sleep. So sleep is very important during any time, but especially during the time that you're fasting. To improve your sleep during the month of fasting, it's important for you to make sure that you're getting your regular sleep. So if you're an adult, making sure you're getting 7 to 9 hours of sleep. And if you have children, make sure that they're getting, or teens, they're getting at least about 9 to 11 hours of sleep. This will make fasting more enjoyable, because if you're well rested, then you're able to participate in the religious part of the fasting and be able to get the benefit of the fasting. And last point, but not least, is exercise. Like I said earlier, exercise, especially if you are someone that has type 1 diabetes, you don't want to do vigorous exercise. You want to do enough exercise to keep you healthy, but you don't want to do vigorous exercise because during the day you're not really having anything to eat, right? You're not drinking any fluids and you're not nourishing your body. So you want to keep exercise light, but it's still important for you to do some exercise, because if not, then the chance of gaining weight after the fasting months can increase. So exercise, light to moderate exercise is recommended for you to do during the fasting months, and this will help you stay healthy and prevent a lot of complications that is associated with diabetes. Fasting is a healthy part of most religion. Can help a person feel connected to the religion, feel connected to their God, but at the same time it's very important for you to know when to fast and when to stay away. If you're someone that is pregnant, then it's not recommended for you to fast. If you have type 1 diabetes and it's uncontrolled, then it's not recommended for you to fast, because when you do fast, you can get yourself in a lot of complications like ketoacidosis, dehydration, that can lead to diabetes emergencies. If you're someone that's undergoing dialysis, it's important that you have a plan in place not to fast, because this can lead to other complications for you. Be aware of hypoglycemia and how to treat it. Aware of hyperglycemia and how to treat it. If you're someone that has type 1 diabetes, it's important for you to have a ketone testing kit at home, so that if your sugar goes extremely high, you can test your blood to see if you have ketones in it, and if you do, then you need to seek emergency attention right away. If you have type 2 diabetes, you can also get very dehydrated and you can get into the hypoosmolar, hyperglycemic coma. So it's important for you to be aware of what your normal targets of blood sugars are. And then when you go out of those targets, and have plan in place as to what to do to stay safe, to prevent yourself from complications that can lead to even further compromise of your health or even death. So fasting is important. Do it mindfully and be safe, so you can get the spiritual benefit, the mental benefit, and the physical benefit of fasting. So until next time, practice those tips that we just talked about, so you can still participate in your fasting and be part of your religion, because spirituality is very important for our mental health. So follow these tips, stay healthy, stay safe, and practice safe fasting. Please subscribe to my channel if you haven't subscribed yet, so we can all work together and live a balanced life. Take care. Bye.